public and private. We purchased these with ESSER funds. This was part of the CARES Act to provide resources for our public schools and for our state agencies. And what this is simply a very kid-friendly and a parent-friendly guide so that our students can understand what they're dealing with. I know this has been talked about a lot in the news over the last several months, but we certainly want our youngest children in the state to have a better understanding of why we are asking them to wear masks, why we are asking them to wash their hands more frequently but all of the social distancing, it's all covered in here, and we're very happy, and we want to give appreciation to the governor, because there's also a letter from the governor on the back, so the families will understand how important this is, but this will be distributed in the coming weeks so that when school starts, the schools can start distributing these to our students. So just briefly want to address the topic of PPE, and our question has come up in the last several days. And over the last few days, we have seen the importance of our decision to create a strategic reserve of PPE, because what we have found, certainly here in Little Rock, on Monday, we delivered about 15,000 masks to Little Rock School District because they had not received their first shipment. I believe 2 days ago, they did receive 1.5 million masks, which is about half of their initial order. So it helped bridge that gap. We've also delivered other masks to other districts that were encountering supply chain issues. Again, we're very dedicated to make sure that all schools have what they need when they start on the 24th, 25th, or 26th. We'll continue to monitor that situation. Also want to report that this is the end of the first week of school for the Arkansas School for Math, Science, and the Arts. Those move into their residential campus, and I have just under 200 students that are on site, and the report is that it has been a very smooth week. A question that has been asked before is, what will we learn from other states that start early? Well, we'll learn from other states, but we will also learn from the experience of some of the other schools that we have here in the state of Arkansas. With that, I'll turn it back to the governor.
Thank you, Johnny. And I wanted to say a word before Lance comes that I designated my high school sports advisory group that was led by the Surgeon General, Dr. Greg Bledsoe, who's done a really good job of hard work with the group. And he's not able to be here today. Lance Taylor is. He's active on that group, but also has his separate responsibilities with the Arkansas Activities Association. And so I wanted Lance to come. Thank you for your work on the group, and please share a word.
Well, first of all, thank you, Governor and Secretary Key and Dr. Romero, for y'all's support. And just like he said, we have a great group that we work with that the Governor put together, and they're all a great group of individuals that all have different concerns and different ways to look at things to improve the safety of our kids as we move forward, and I've enjoyed the opportunity to work with them, especially the leaders. So, to tell you the truth, to say that I'm excited to be here today is an understatement, because right now I know across our state our kids are excited with this news. I'm excited, and I know how hard they have worked, and not only just in athletics but our activities. I know our band and choir people have worked with Dr. Romero and his group of doctors this week, and they're going to have the guidelines out, and they're going to be very excited. But also, you know, we have cheer and dance, and now football is going to get started, and volleyball. We've already got golf and tennis started, and cross country's next. So I know all those kids that have been working hard all summer and together all summer are very excited to get going, and I'm just proud to be here today to represent them and what kind of job they have done to protect our kids this summer with social distancing and the mask, and making sure that they're keeping our kids safe. And again, I believe our kids are safer and our coaches making sure we're following these guidelines than they are on the outside or whatever they're doing when they're leaving school. But again, before I leave here today, this is the key. And I'm going to tell all the athletes and all the kids in the activities and their instructors out there, this is the key. And it's not all what's going on at school, because you are doing a great job there. But when you leave school, continue to wear this, continue to social distance, and be smart, because just like the governor said, we want to start, but we want you to finish your seasons, and we believe this is the key. So keep up the good work, and I'm excited for all of you. Thank you.
Thank you, Lance. With that, we'll take any questions. Yes.
What's your recommendation to, a lot of the Arkansas towns are famous for their full bleachers on Friday nights. Maybe a two-part question. Will it be like kind of first come, first serve? And then how do you go about monitoring and police nights?
Very good question. And the answer is as to how you comply and determine bleacher space is going to be up to each individual school district and the athletic directors there as to whether they restrict it to, parents and relatives, or obviously it's a big community event, and they could be spaced along the sidelines or the fence, as they call it, but they have to be socially distanced. So that's up to them to figure out. In terms of the compliance, we would expect and hope that the athletic directors or the superintendents will have people that are there, not to be heavy-handed, but to remind people, they get excited in a game, hey, spread apart. You've got to be 6 feet apart, or put on your mask. I mean, those are the kind of things that we can but remind people, because we do get excited about the games, that we all have that responsibility. But really, the compliance work will be up to the school district in accordance with guidelines. Yes.
Will districts also be responsible for any contact tracing at those events, and if a positive case were to arise?
The school district, just like we do other cases, that will go to the Department of Health, that they'll have a nurse investigator that will contact the individual that is positive. That will be assigned to contact tracing, so that will be handled by the Department of Health. We're going to be working in the next week to streamline that. I've asked Secretary Romero and Secretary Key to work together to make sure we can prioritize and be responsive to the schools as these positive cases might pop up.
Governor, we're 5 months in this pandemic. We've got more than 500 people dead. You're trying to get these supplies for the testing. You're still not getting what you need. Does this reflect a failure of leadership at some point in the government, whether it's the state or whether it's the federal government? Why isn't this fixed?
I'm not sure I can answer that. I know that they've worked hard, but the fact is it's not fixed yet. I'm hoping that this month it will be fixed, that we're looking at a lot of different solutions. Federally, they're pushing the laboratories to do more. I know that they have made acquisitions to increase that demand for them, but it is disappointing that we're at this stage, 5 months in, as you said, that we're still struggling with sufficient testing. And we thought we had that fixed, but that was whenever the demand was down. And it was fixed at one level. It wasn't fixed at a higher level that we have today across the United States. And so I don't want to be, it's not my role, and it's not the right time to say what we haven't done or what we should have done better, because there's going to be a time in history that we'll have a review commission for COVID-19, and we're going to look at that more deeply so we can learn from it. But now's not the time. Now's the time to say, let's get in there and let's fix what we know is a system that's not working perfectly right now.
Had any further discussions with other states in regards to the consortium with the Rockefeller Foundation?
There's really a surprising number of states in the sense that I think there's close to 10 states that have agreed to participate in that coalition. Once we know the final number of that, the Rockefeller Foundation of New York will then start allocating what each state could do and get specifics on it to tie it down into a longer-term commitment and contract. So it's a step-by-step process. It's not going to be an immediate fix, but we're looking at this further into the fall, and I hope this will be part of the solution. Let me go remotely. Is there anything?
Yeah, Governor, this is Andrew, AP. There was a open letter that was published as a full-page ad in the Democrat Gazette today from a group of parents, guardians, community members raising concerns about the resumption of in-person classes this month, and also had some recommendations, including a more phased-in approach to returning to in-person classes, more defined parameters for closing schools. Wanted a chance to read that, and if you had any response to it. And had a second question for both you and Secretary Key. Wanted to see, how confident are you that there's going to be enough teachers, enough staff, enough substitutes to keep schools open, especially when we start seeing cases, seeing people having to quarantine? Is there going to be that pipeline for that when that happens?
Thank you, Andrew. And just again, in terms of your first question of the open letter, I have taken a look at that, and we value the ideas presented by members of the community, the educational community, and others across the state. I looked at some of their priorities. We've addressed many of them, from the PE concerns to the first one was the phased-in approach. You can look at what we've done by delaying the start of school by 2 weeks. That gives everybody more opportunity and time to be prepared. I think that was a phased in for us. Obviously, we want to start on day one with in-classroom, and we think we have a good plan for that, but we welcome those ideas, and we've been responsive to many of those that we think are rightfully set forth. And we'll ask Secretary Key to comment more on that if you wish, and the other point.
Yes, I have read that open letter as well. It reflects the feelings and opinions and statements that many others have sent us over the last several months. So it's something we definitely take to heart. We understand the concern that's out there, and we also understand that there is a need for students to be on campus. There are students whose needs will not be met completely by virtual means, and it's very important that those students have the opportunity to be on campus when the school year starts. As it relates to the substitutes and staffing, that is an issue that we are watching. The hiring and the staffing up with respect to substitute teachers is very much a localized situation. I know here in Central Arkansas and in many other places, they use temporary or hiring agencies to those agencies to secure their substitutes, and all the districts that I've talked to are working to increase those numbers. But the availability of staffing is something that when the school year starts, we'll factor into the response levels, the document that we issued several weeks ago, so that those operational decisions can be based on availability of subs, the availability of teachers, and the possible impact of teachers being quarantined or being close contact or positive cases. So those are all things that we're looking at on a regular basis.
Another question?
Hey, Governor, it's Nick Camper with 5 News in Northwest Arkansas and Fort Smith. Had a couple questions about testing delays. The first one's just sort of an update. About a month ago, the Arkansas Department of Health said that they were going to increase their staff to help speed up testing and sort of the return on those results. And then I wanted to see how that was going. And then the second question just has to do with what is being done to ensure that there's going to be universal quick turnaround times as we head into the first couple weeks of school?
I'll ask Dr. Romero to come in reference to the staffing. In reference to the turnaround time as we head into school, we're still hopeful that we will have some point-of-care testing that's available. We're still waiting on the testing kits that we have ordered, that we are waiting delivery on. We get those, that we're going to utilize that to assist our schools, in addition to our normal capability through the Department of Health, that we are staffing up to be ready and increase the, or reduce the turnaround time. Dr. Romero.
So with regard to increasing personnel within the laboratory, I actually had a chance to meet with our laboratoricians today. We have added to that body of individuals. There is a national shortage of well-trained laboratory technicians. We are trying to get more. We have space for more hires, but it is a very tight market at this time, so we are looking for that. I want to add to that we have a third high throughput machine that is in the phase right now of validation, and we hope to have that up next week, and that will add more cases, more tests that we can run. With regard to testing of, so we have a plan that is in evolution. We definitely want those students that, or staff or teachers that have symptoms that could be consistent with COVID to seek testing at their local health units. Every county has a local health unit. We will do point-of-care testing there, and if we establish a diagnosis, those patients will be fed into our system for contact investigation and tracing. Those individuals that are negative will be backed up with a positive, with a test called a PCR test to confirm that negativity. If we have an outbreak in schools, we are currently exploring the possibility of having up to 10 teams that can be deployed immediately to those areas for mass testing of the students in those schools. So we are planning ahead. We have the resources to do that monetarily. We will be hiring for those positions in the near future.
Next.
Governor, it's Neil Gladner in Hot Springs. For Dr. Romero, I'm just curious what's involved in the training of lab technicians. I know you hired and trained contact tracers. If that's much more detailed. Governor, with regards back to that letter, one of the things parents are talking about is a more defined and transparent way of communicating to parents when there is a positive test in the school. And I recognize you got to balance that against creating a panic, but can you talk about a better way to communicate with parents if there is an outbreak?
Yes, actually, I've challenged both Secretary Key and Secretary Romero to be as transparent as possible, consistent with privacy guidelines, so that we can provide as much information as possible in reference to any positive cases in the school districts. We want information that is out there, and so that's still an objective that we have, that they're working on, and we hope to be able to refine that more carefully in the coming days. And then, what was the other question?
Training in all aspects of laboratory techniques. In addition to being trained in those situations, they still are trained in our to know exactly how we're doing our tests. So we're looking for graduate individuals that have gone to school and have a degree, and then bringing them in. This is a unique, if I may, Governor, this is a unique opportunity for young graduating technicians. You won't always have this opportunity to enter into a high-tech modern laboratory right away. So I would encourage you to consider any opportunity that you have to become employed by the health department.
Frank.
Yes. Governor, there were 73 new bill on one day this week, I believe, reported, 34 at the Human Development Center in Boonville. These people are, they're not free to leave. And and I guess why do we keep seeing these large outbreaks? And what obligations does the state owe to these people and their families?
Well, of course, the Human Development Center is different. Voluntary by the families who want their family member there. Those are a lot of different decisions go into that. But we have a great responsibility to them, absolutely. And that's why we have initiated 100% testing. That's why we have worked on the staff and the facilities there to make sure they're a safe environment. And if we identify a positive case, then we address it. In the prison environment, first of all, we're doing that mass testing this month, which means we're testing 100% of our inmates again in prison, and that allows us to detect any positive cases, to get ahead of it, to make sure that we don't get behind in terms of dealing with this in the prison system. And it's been very successful. It has allowed us to identify more cases, but it hasn't been an excessively high positive rate as we've gone through the testing in our different prison systems. And then they have reviewed, and at my direction, any nonviolent offenders, any that are appropriate for release, that could be considered. And so that's something that the Board of Corrections does consider if they are nonviolent type offenders that are there and are close to their or at their parole date, that could be accelerated. So they have taken action on that, and they're continuing to review that. Any other questions?
One more. What would you say to people whose checks are running out? The government, the larger amounts have gone down. They've got rent to pay. They've got bills to pay. They may be struggling to get food. It just seems like there's no end in sight. What message would you have for them? And the Congress has gone home. They've gone home.
That we understand the challenge and the frustration that they have. We have the standard amount of unemployment compensation, but that is less wage that they would make if employed. And so we would like to see two things done. Opportunity for jobs. That's why we want to keep our economy moving. And we have job opportunities there. We hope they fit. That's important. Secondly, we want a solution to this. We do believe that it's important for our economy and for individual families to have an additional amount for unemployment compensation that can be agreed upon by Congress because these are tough times, and we want to make sure that the safety net is there as well. We monitor our food banks. We want to make sure well supplied to help our citizens as they endure some economic hardships. Thank you all, and you have a great weekend. I hope it's a wonderful weekend for the entire state, and be safe and make sure we have a good weekend. Thank you.
All right.
Thanks so much for joining us here on THV 11. You were just listening into the governor's daily press briefing regarding COVID-19 in the state of Arkansas. We will get straight to these case numbers that have been reported. In the past 24 hours, an additional 626 more cases of COVID-19 have been reported in Arkansas, bringing the state's total to 52,392. There has been a decrease in hospitalizations. That was by 7, bringing that total to 466 people still fighting the virus from a hospital bed today. We've seen an additional 5 deaths, bringing the state's death toll to 587, and it was announced today that the positivity rate in the state is at 8.9%. Regarding announcements today, Governor Asa Hutchinson announced that he is order extending the public health emergency for another 60 days. This is important. Why, if you ask? Because we are still in an emergency. He expressed that we still need to make more progress when it comes to our positivity rate, especially with school starting in just 10 days. A directive announced from the Department of Health on outdoor and indoor venues when it comes to sporting events for the school year. facilities are expected to not exceed 66% capacity. People who are attending these events are expected to practice social distancing, and they are expected to wear their mask. More on this directive will be coming out later this afternoon. And regarding PPE, we've heard from a lot of you regarding that for our teachers who are returning back to the classroom, our administrators in the classroom. The state is creating a reserve supply of PPE that will be distributed to school districts across the state. And they announced today that Little Rock School District actually received 1.5 million masks, which is about half of their order. So they're still expecting more, but that is a start for the school year to start again on August 24th. These numbers are constantly developing. They are constantly being updated. We are working hard here at THV 11 to update the numbers, verify information, and get answers to the questions that you all have for us. I invite you to join me tonight on THV 11 News at 5, 6, 6. And before then, if you want to check for any more developments, please check thv11.com for those. I'll see you this afternoon.
Entertainment and shopping. Enjoy luxury accommodations with stunning views of the turquoise Caribbean